This program has been paid for by the sponsor and does not reflect the views of PCN.
Hi, I'm Lisa Schaefer, CCAP Executive Director. Welcome to County Connections, a show spotlighting county government's involvement in your everyday life. We're here today to talk about two of county's top legislative priorities for 2024, spotlighting mental health issues and mental health funding and our juvenile detention capacity crisis. Joining me in the studio here today is Northampton County Commissioner Lori Vargo Heffner. Lori, thanks so much for being with us today.
Thanks for having me.
I think you have a really unique perspective when we talk about mental health issues because you're not only a commissioner, but you're also a mental health provider. So can you tell us a little bit about what you're seeing in terms of mental health needs among our Pennsylvania residents?
Sure. I'm currently employed as a psychotherapist at St. Luke's University Health Network. And the changes that have occurred in mental health over the past few years post-COVID, and then over the span of my career, which is much longer than COVID, are so incredible. We have such long waiting lists for service. We have so many more constituents that need care and want care, and it's sometimes difficult to fill the need. I'm blessed in my organization that we have a full continuum of care, and that sort of parallels what the counties provide, because counties also have a full continuum of services, starting from early intervention, ages 3 to 5, and then on up to the aging. But all of those constituents in different capacities need services, and counties are required to provide all of those. So recently, it's just been more difficult with more and more constituents needing the services, less people able to provide them. It's creating longer wait times and then gaps in service.
So when you're seeing those longer wait times, that need for services, what happens to those people? Where do we see that come out? Do we see it in our jails? Do we see it in emergency rooms? What's happening to those folks if they can't get services?
I think a couple of different things happen. I think some folks end up with more emergency room visits in crisis and then have wait times for like the continued services. I think some folks end up in inpatient because they weren't seen soon enough. And so we didn't take care of it when it was a small problem, and now it's a more serious or more critical care issue. Some folks who are seriously and persistently mentally ill may end up in some of the criminal justice systems because they're not getting the care, they're not in the continuum. Sometimes it's an accessibility or an affordability issue, and so they may end up in a situation where they commit a crime or they get picked up for loitering or something, or even if they're just off their meds and they're off balance and they're perceived as having a problem, whereas once they get that adjustment made, they're back to functioning citizens. But in the meantime, the jails are getting more and more filled with people who have persistent mental illness issues.
You mentioned a few minutes ago the county responsibility to provide mental health services. So prior to this current fiscal year, counties hadn't seen an increase in state funding for mental health services for about 15 years. This year, we saw an increase in about $20 million. Did that help? Does that move the needle? What comes next?
I think it supports what we're doing, but I don't think it moves the needle very far because we're so far behind that that's not going to help us catch up. I also think that, again, it's not like we're just going to take care of X problem. Okay, we're going to fund all the children. Well, that's great. What about everybody else? We're going to fund schools. I know $100 million was given to schools last year, and that's great. But then what happens when those children go home from school? What happens if they have a family member who has the illness? What if part of what identified them in the school is somebody else's concerns in the family? So the immediate need gets met, and they get a little bit of an intervention, but they don't get a big intervention. So I think more money is needed to fill and maintain the services that have already been set up in the structure, because the structure's been there for a long time. It's just that we can't keep filling the needs if we don't have the funds. And also if we don't have the people to provide the services.
So what you're saying is we need a big picture look at the mental health system, not just one piece of it or another.
I think so. I think the way I like to look at it is it's a continuum of care. You can't just treat Lisa with depression. You have to look at if there's a child that has some needs, if there's somebody in school, if there's young adults or teenagers with transitional issues, are there veterans with problems? Are there people who are just in crisis, but they could use some other companion services? Am I dealing with the spouse or a parent? And am I dealing with an aging person? So there's so much more to treat. And I think counties are well poised to do that. Like I said, the funding needs to be there. And I know that agencies have it, and we contract with a lot of agencies too. But if they don't get the funding they need, they can't stay open to be able to offer those things that we need.
So when you look toward your own county, so you're kind of merging your personal, your day life and your commissioner life, you mentioned a lot of different services and a lot of different needs just now. How would your county be able to use an increase in funding if that was to happen?
I'm sure that it would keep most of the services that we have in place. It would probably allow us to increase the numbers of people we serve and hopefully get those wait times shorter so that they're not waiting as long to get into the system. I know that one thing our county is specifically doing, and we may touch on this, I think we did touch on this, we've opened a long-term residential treatment center that is going to be doing assessments for court competency. So some of those folks with mental illness can be assessed prior to getting into jail or in lieu of jail so that we could see if they really did commit a crime or, if was it a mental health issue. So I think more programming like that coming into fruition would be really helpful. And I'm excited that we finally have that.
Because I guess, the jail setting isn't really conducive to someone who has a mental health issue, to them getting the best treatment, to improving their condition. So being able to provide those services and maybe divert them if the situation is warranted can help improve outcomes for everybody.
Absolutely. And if, again, there were these outpatient programs or community-based programs where people could go and get their psychiatric needs met, get some counseling, be part of some groups, get some social work services to meet some of their housing needs or their food needs, then maybe they wouldn't end up in the criminal justice system, because most of them don't belong there. The other thing is when they get into the criminal justice system, it costs a lot because they're getting services that they haven't had while they were not there. Especially when I think about folks that have gone without medication for such a long time. They get into the criminal justice system, they get medicated, they get back up to a functioning level, and then when they're released, they don't have access to continue with those medications. So they'll just end up back in the system again.
So it sounds like an increase in funding could really have a significant return on investment for counties, for our communities, and for our people.
I believe so. And I guess mental health, mental illness, it's not a crime. More and more people have it. I think, I guess I wouldn't even try to come up with a statistic or a number. I just know in my experience, you'd be surprised at how many people have something like this in their family or something like that within themselves. And I think that it cuts across all continuums, all economic levels, all social levels. I think it absolutely would provide a return on investment. And I think it would help support the greater goals of people in Pennsylvania overall if we started to treat these things more seriously and put the funds in the system.
So if you had a final message about the need for mental health funding and the work that counties are doing, what would that be for our viewers?
That mental health services are needed continuously, that this money is not an entitlement. It's not something that should be seen as a problem that's going to go away. But the more that we can address it and even start to address it at a prevention level, we can make it better for most citizens across the state of Pennsylvania.
And that's really all that we all want, to be able to make lives better.
That's what I think. That's why I've been doing it for as long as I have.
Well, Lori, thank you for your time here with us today, for sharing your experience as a provider and as a commissioner. We'll be back in just a few moments to talk more about the juvenile detention capacity with Clinton County Commissioner Jeff Snyder.
After a great victory over Union forces in June 1863, Robert E. Lee marches his army to Pennsylvania. The advancing Confederates clash with General Meade's Union Army at Gettysburg, beginning the most famous battle of the Civil War. Explore our nation's past and the Gettysburg battlefield with the Gettysburg Collection. Become a member to stream the library online. Learn more at gettysburgcollection.com.
Welcome back to County Connections, where we're here talking about county's top priorities for 2024. Next up, we're going to be talking about the juvenile detention capacity crisis, and joining me in the studio is Clinton County Commissioner Jeff Snyder, who also chairs CCAP's Courts and Corrections Committee. Welcome, Jeff.
Thanks for having me.
So, juvenile detention capacity crisis, that's a mouthful. So let's try to break it down a little bit for the folks who are watching this show. What responsibility do counties have for juveniles who are involved with the criminal justice system?
Once juveniles get involved in the criminal justice system, it comes back to the counties are responsible for delivering all the services that they need in a timely fashion for a community-based services for all of their needs. And that comes to housing them in a safe environment.
So is that what we mean by juvenile detention, is housing them?
That's part of it, yes.
So what else do we need to know about juvenile detention?
Juvenile detention includes the services that they need while they're there, and that may be mental health services. And unfortunately, too many times today we have juveniles that have physical and or drug-related issues that come to detention centers that we have to deal with.
So we're talking about a capacity crisis.
Yes.
What does that mean?
Well, started back in 2016 to 2021, we have had 16 detention facilities that have ceased operation in Pennsylvania. And as of last month, Pennsylvania had 513 licensed detention center beds, but only 366 of them are operational because of staff shortages. Meanwhile, the average length of stay rose from 17 days in 2018 to 27 days in 2022. And there's been a significant increase in the cost of wages for staffing and liability and insurance costs that has also led to the decline in the amount of shelters that have been able to remain open.
So those are a lot of numbers you just gave us about what's going on. What makes this a crisis?
Well, because of the number of beds, we have more juveniles needing those beds than we have the bed capacity. So counties are having to send youth out of state. And because of that, there's additional costs to the counties for that. But it's not just the cost that causes a burden to the families. Now we have additional costs to the families for travel, and then it causes more additional mental stress, not only for the youth, but to the family to have to travel out of state. And unfortunately, we've heard anywhere from costs from $500 to $5,000 a day, depending on what that child may need for services for out-of-state expenses for costs per day.
So how's your county currently handling that crisis? How are you dealing with these challenges?
We have met with the Department of Human Services and had some conversations with them. Today we met with other commissioners and people at the Capitol to talk about this issue being a crisis, and we've asked the state for a partnership in helping us deal with this crisis because it needs to be resolved. We need to find a way to deliver the services that are needed so that we can have a holistic approach to deal with this, to provide the services that are needed to every county so that we can keep our youth more local and return the number of beds needed for the number of youth in the full Commonwealth.
What does that look like? Is that funding? Is that other resources? What do you need to make that happen?
Funding's a big part of it, absolutely. But also, there are so many restrictions and requirements for staffing, and that has to be looked at. Just the whole gambit of what is required to staff a facility needs to be looked at. And certainly I'm no expert, and that's why we're looking out to other agencies to help us look at what needs to be done to correct the situation.
What happens if it's not corrected?
Well, we're going to have a real problem because we really have to work together with the state and local and community providers, stakeholders, to broaden the community-based treatment programs. If we don't, Lisa, unfortunately, what is our youth going to do then? There's no place to put them. It's already illegal to put youth to incarcerate them in adult settings. So we have to resolve this. There's no other place to deal with our youth unless we address this issue.
And if the issue can be resolved, if we can get some funding, if we can find these beds and bring these youth closer to home, find them the services they need, what does that mean to these youth? What does it mean to their families?
It means stability. It means knowing that their problems are going to be dealt with locally, and that they know where these services are going to be delivered.
We've talked about partnering with the state. You talked about some other stakeholders. Are we hearing about counties trying to work together? Are we hearing about some local solutions that are happening out there? And are there models that we can lean on?
Fortunately, my county, we're lucky, I guess. We are in a partnership with 4 other counties. 5 counties own a detention center, but it's not without problems. We have staffing issues. So we have a model, and we are out there working with other counties, and when not all those beds are used by the member counties, then other counties can use those empty beds on a per diem basis. But there still seems to be some issues with staffing, and it's a model, but it needs some improvement. But again, we can use that as a model for other counties to look at. It's there, and we're willing to share what we have with other counties if they'd like to come and look at Central County's youth program.
Well, that sounds like at least a good model. Of course, as you said, still needs support, still needs funding and partnerships. We talk about this being a crisis. Has it been a sudden crisis? Has this been coming on for a while? How did we get here?
Well, I think we got here because it's started back in 2006, as I said. And it's just been a steady decline, and now we're at a crisis situation. And I guess the million-dollar question is, why did it take a crisis to get everyone's attention? Well, we are at a crisis right now at this point, so now we've got to pull together the state, county, other agencies to fix it and bring all the stakeholders together to make it happen.
The residents of your county, the residents across Pennsylvania, they probably don't all have youth, members of their family, people they know who are involved in the juvenile justice system. So why should this be an issue that everyone cares about in Pennsylvania? Why should your other residents who might not have those interactions pay attention?
Well, I think that when you're talking about the youth of your community, it is a community issue, and it affects everyone sooner or later, and it's a community issue, and I think that people do need to pay attention to it, especially in your smaller rural counties. Everybody knows everybody. So I think it is a community issue, and people do pay attention. So,
any last words for our viewers about this issue? Well,
I think just to say that we're working on it. We realize it is a crisis, and I think that we had a good day in Harrisburg today. I think that our representatives that we had an opportunity to speak to today and their staff listened to us, and it was a good day in Harrisburg.
Good. Well, counties certainly are looking for that partnership with the state. We're getting that message out there and trying to make life a little bit better for all of our residents who are out there in our counties.
Absolutely.
Thank you, Commissioner Snyder, for joining us here on County Connections. We'll conclude with just a few remarks from CCAP's President, Berks County Commissioner Michael Rivera.
PCN is Pennsylvania history and culture. From the founding of our nation to the struggle for freedom and equality. Listen to the words of authors as they discuss Pennsylvania and the people, places, and events that relate to the Commonwealth. Celebrate our diversity, embrace the past as we look to the future, and be a part of building our nation. PCN is Pennsylvania history and culture. A huge party is coming, and you're invited. In 2026, America will celebrate 250 years as a nation. Now through 2026, watch PCN for special programming. Join us as we highlight Pennsylvania's contributions to the founding of our nation with Celebrating America's 250th in Pennsylvania. For more information, go to PCNTV.com. PCN is everything Pennsylvania.
I'm here with Berks County Commissioner Michael Rivera, who's serving as president of the County Commissioners Association of Pennsylvania for 2024. Michael, congratulations on being in the leadership for this year, and thanks for everything that you do for counties. We've been talking about our legislative priorities here on this show. Talk to us a little bit about how these priorities are decided. Who comes up with these?
Okay. So, well, first of all, let me thank you for the job that you do. It's a pleasure to serve as president this year, and I'm looking forward to it. So the priorities are set by the members of CCAP. So they're not set by the CCAP staff. They're not set by myself as a president or one individual. They're set by the membership in general. So we have different committees that are set up. These committees will meet and they'll decide on what are the needs of that particular area. So be it around election reform, be it around veterans, be it around the emergency services, whatever it is, they determine what are the needs, and then the committee will decide which of those should be passed on to the general forum for to be voted on as a priority. And the committee submit those, and then in the fall conference in November, the membership in general votes on those priorities to see which will be the new priorities for the coming year. So they're set by the membership to be able to be acted on by CCAP. And this is important because what that does, it says all counties are talking as one voice. The counties themselves set the priorities, and the staff at CCAP is then pushing those priorities forward with the administration and with the legislature.
You've mentioned the membership, and you just said all counties. So there are 67 counties in Pennsylvania. How many of them are members of the association?
So all counties are members of CCAP. We have CCAP. The membership is set by law, and all counties have to be members of CCAP. So that's important to understand, and because when we set these priorities, we're representing all 67 counties in the Commonwealth.
And all counties have a voice in these matters.
And all counties have a voice in these matters, correct.
So, counties say, here are our priorities. I'm guessing we're taking those to the General Assembly, where our state partners, our legislators, working with Governor Shapiro and the administration. Why is that partnership so important?
It's important because the General Assembly and the administration, they set the laws, what counties can't do, and they provide funding for many of the jobs that the county does. So it's important that we have a strong relationship for them. It's important that they reach out to us and say, you know what, we're thinking about this law, we're thinking about proposing this. What do you think? Is that something that counties would support? Is it something that would work for counties or wouldn't work for counties? So we want to make sure that we're partnering, that we're working together to make sure, because in the end, Lisa, everyone's working for the betterment of the Commonwealth and to be able to serve the residents of the Commonwealth in the best way possible.
Because really those residents, they're both your constituents and they're the constituents of our state partners.
Exactly. Yep.
So when we have that common voice, when we work together, we can really try to make those improvements on the ground. And it's really important we have that unifying voice on behalf of our county government.
Exactly. And we want the legislature and the administration to see CCAP as that one voice. Again, if there's an issue where they're going to come is to CCAP to say, you know what, will this work for counties? Understanding that the counties really are the boots on the ground people for the Commonwealth. We're out there doing the human services work, running the jails and many, many other services, running elections and other things that have an impact on the daily life of our residents.
So many ways that people probably don't even realize that they interact with county government on a regular basis.
Yep. Yeah. It's interesting because when I go to speak at different places, I'll say, okay, how many of you know what a commissioner does? Raise your hand. And I may get one hand or two hands. And I say, well, how many of you know what counties do? And same thing, maybe one hand or two hands, because in school they talk about state level, federal level of government, but very rarely do they talk about the county level of government, which has a bigger impact on the day-to-day life of many people, more so than the state and the federal government does.
And that makes it so important for an association like ours to have that unifying voice and be able to tell that story about what counties do.
Yes, it does.
I'm Lisa Schaefer, Executive Director for the County Commissioners Association of Pennsylvania. Thank you for joining us for County Connections, brought to you by CCAP. For more information about county government or about our 2024 priorities, please visit us at www.pacounties.org.
This program has been paid for by the sponsor and does not reflect the views of PCN.